The survey we carried out, we realized that mothers don't know what postnatal care is. Mothers think if I give birth, I only go back to hospital for immunization.
A large proportion of maternal and neonatal deaths occur during the first 48 hours after delivery. Thus, prompt postnatal care for both the mother and the child is important to treat any complications that arise after delivery, as well as to provide the mother with important information on caring for herself and her baby. From this need, Teheca initiative embarked on providing postnatal care services to the mothers and their newborn babies. Daniel Yonga, a personnel at Teheca, says they jumped in to fill the gap that is left by the healthcare system in the country.
Teheca is a tech healthcare startup company that rose out of the need to ensure that each unique individual has tailored care plan. And from there we knew that, looked at our current healthcare system, and we try to figure out how best can we help our people within the Ghanaian community.
He says many mothers and babies continue to die after birth because they do not get knowledge about what they are supposed to do after giving birth. Through the use of technology, they have been able to respond to the needs of many mothers by giving them information and providing health workers to take care of them and the baby and give emotional support, especially for first-time mothers. He says mothers are provided with baby kits that have all the necessary things that are required when a mother is going to give birth. Carol shares her experience as a first-time mother who didn't know how to even place the baby as it breastfeeds.
And I wasn't really taken through that session of like, this is how you're going to breastfeed the baby. I usually tell my friends that I used to find a lot of difficulties in breastfeeding my baby because my breasts are small. So I would struggle of whether to bend breastfeeding or whether to lift my baby up to breastfeed. And those are the things that our health workers really teach mothers.
Noting that because hospitals do not provide education on how mothers should deal with postnatal depression, Teheca came in to provide the care and education. Through partnering with hospitals, they've been able to follow up on mothers by sending them messages to remind them of the postnatal services and taking back their babies for immunization.
So I would use an example of one of the hospitals, that medical centers that we partner with, called Forum for Health Change Medical Center in Wampeo. We talked to the doctor of the hospital. He sent us contacts of the mothers. I think that week he sent us something like 15 contacts. So we followed up. We sent the SMS to mothers to remind them to go back to the hospital. And surprisingly, when we called him, he told us, when mothers saw your messages, over 10 of them came back out of the 15 mothers for the checkups.
She says the healthy workers offer full-time services like educating the mothers on when to rest the baby and how to take care of the baby.
Health workers get time to teach mothers how to care for themselves, how to breastfeed the baby, and how mothers should take care of their wounds in terms of for those that have gone through C-sections and for those that have given birth normally. I would say first-time mothers really get stitches.
They are optimistic that they will expand their services to rural areas through the microcluster platform by bringing together mothers from different communities by providing them with information and partnering with other health sectors.
So for mothers that are in rural areas, we are planning to have the microcluster platform. It's called microcluster, where we source for mothers from different communities and send them to a partner hospital in their area to educate them on maternal health.
According to a survey conducted by Charlotte Warren and Pat Daly, it shows that at least 125,000 mothers and 870 newborns die in the first week after birth in Africa. This proves to us that birth, labor, and postnatal care are really critical for the growth of the newborn and the mother, a thing that Teheca initiative has embarked on to educate mothers on how to take care of their babies and how to take care of themselves after birth. Olivia Komugisha, MCI TV.